I'm Dr. Mukarram, consultant pulmonologist, Prathima Group of Hospitals, Kachiguda. Today I'll be telling you some key points about chronic obstructive pulmonary disease, which is known as COPD, which is a disease which is characterized by airflow limitation due to some noxious particles or gases or exposure to smoke, which causes bronchoconstriction. There is a patient presence with cough, breathlessness, and lot of sputum production. So we have to identify these type of patients and we have to treat them accordingly. So actually why it is problem in the society with COPD is because it is the second leading cause of death in 2019. It is a slowly progressing disease because it is an unidentified disease. What happens in COPD is usually people who smoke and more than 20 years, who are above 40 years of age, and who have exposure, high occupational exposure, and who have exposure to noxious particles, gases, air pollution, and who have chronic respiratory infections on and off. These are the patients who are target people to develop COPD. So we have to diagnose them with a pulmonary function test and categorize them on the basis of the pulmonary function test as mild, moderate, severe, and very severe, and treat them accordingly. And treatment is basically on the basis of bronchodilators. The airways which are constricted, we have to treat them with bronchodilators, inhaled corticosteroids, pulmonary rehabilitation, and we have to give them good diet, and we have to plan therapy accordingly. So I request every one of you to get yourself evaluated with this disease and get yourself treated as early as possible so that we don't land up in complications which cause extra pulmonary effects as well. Thank you.